One significant cause of back pain that I see in my practice is sacroiliac joint dysfunction or sacroiliac joint pain. This can be just a phenomena of life as we get older, or it can be caused by having fusions or other procedures that secure the levels above the SI joint. And what happens is patients will, it can also be caused by ankylosing spondylitis or some other of the spondyloarthropathies, but this can cause quite a significant amount of pain. And through the years, we've treated this with injections of steroid and with other things that you can put in with platelet-rich plasma and amniotic fluid and things of that nature. But we've also done ablations of the sacroiliac joint. The problem with these procedures is that they're more temporary in their last, okay? Now, radiofrequency ablation will typically last between a year and 2 years, which is pretty satisfactory to a lot of patients, and then you can repeat the procedure. But what if your patient says, I don't want to just continue to have procedure after procedure, I want, quote, a fix for this? Well, we do diagnostic blocks in the SI joint, and the SI joint is pictured right here. And so you can see that the SI joint has some movement. So some patients who sit a lot and continually sit on their ischial tuberosity will have pain in their SI joint because of that. So what happens is if we can get a positive diagnostic block, we know that if we come in and stabilize the joint by putting in some sort of a fusion, that the patient will have less pain. So there's been different options through the years that have come out. The one that I particularly like, because it's a posterior fusion and it's very direct, is called corner lock. And so what I'm doing now is once I have a positive response to an SI joint injection, I'm offering the patients either an ablation or a corner lock procedure. And if they opt for the corner lock procedure, we go into the OR, we put a pin at the bottom of the SI joint and one at the top, and then through a series of dilators, we implant a bone graft that fuses the joint. It's a very simple procedure with small little incisions we have to close, and really the recovery is pretty remarkable. What I think you'll hear from your patients is that in a few days or in a few weeks they're feeling a lot better. Whereas in the past we used to make people stay non-weight bearing for several weeks, even sometimes months in some cases. This is getting people back to their activity faster, and it's fusing their joint nicely.